everyone. Welcome to Psychotherapy Networker online. We're excited to have you join us today, and I'm so excited to be joined by Dr. Jennifer Shepherd Payne. Hi, Jennifer. How are you?
I'm great. I'm really
Great.
happy to be here.
Thank you. Um, Today is going to be a really exciting conversation. We're going to be talking about treating systemic trauma in the African American community. This is an area of passion and specialization for Jennifer, and she's doing some really exciting work in the field that I can't wait for her to share with us. Before we dive into that today, I want to give you a little bit of a background for her. And while I'm doing that, if you want to go ahead and put in the chat where you're joining us from, that's always fun to see where folks are coming from. Um, okay, so Jennifer is a research scientist and clinician for Kennedy Krieger Institute in the Center for Child and Family Traumatic Stress. And also the Center of Neuroscience of Social Injustice. She's an assistant professor at Johns Hopkins University School of Medicine, and the coordinator of the Acceptance and Commitment Therapy Clinical Services within the adult segment of CCFTS. Um, in addition, she's a board member of MEND, which is an international organization of clinicians of color who are trauma trained for helping oppressed communities. Um, did I cover it all, Jennifer?
Yeah, I think you did. Yes,
Okay.
absolutely.
So then most importantly, and sort of what brings us here today is that Jennifer is also an author of a book that is coming out, is actually available now, officially comes out on December 1st, but you can get it already. Um, uh, and uh, and that's a little bit about what we're going to be talking about. So the book is called Out of the Fire: Healing Black Trauma Caused by Systemic Racism Using Acceptance and Commitment Therapy. And Jennifer, why don't I turn it over to you and let you tell us a little bit about the book and where this idea sort of developed from?
Sure. So I can give you the long version or the short version. I think I'm going to try to kind of go in the middle, in
Somewhere in
between.
between.
Yeah, somewhere in between, because really, actually, like these ideas started from the time I was a child, but I'm not going to go that far backwards. So I
Okay.
think, basically, I have been really interested in underrepresented populations and their health and their ability to thrive since I was, young. And so when I was, uh, or when I became old enough to go to college, I went to UCLA and got my bachelor's degree in psychology at UCLA. And I worked at a number of different organizations in my community, which happened to be Los Angeles, California at that time. Just taking a look at what was going on in the community, some of the inequities that happened in the communities. And, I decided to go back to school, get my master's degree. And so I got my master's degree in social work because I really wanted to help to affect change in communities. Long story short, went to school a third time to get my PhD in social welfare at UCLA. And the reason why I went to get my PhD, it was a couple of reasons. One reason was because I was working on the grounds, doing clinical work with clients in underrepresented areas in low poor income areas. And I was really kind of frustrated at the fact that I felt like I really couldn't affect change the way that I wanted to. And so I said, well, possibly I might be able to affect change in a better way by doing research. So I went back to school, got my PhD in social welfare, and I began to do some research. Um, the research really kind of started off with looking at mental health and looking at persons of color and how they interact with the mental health system. And there's a lot of research out there that says that when I say we, I mean African Americans and other underrepresented populations are underrepresented in mental health treatment for a number of reasons that I won't go into in detail. But that they rely on other outside social supports for emotional health, such as the church, barbershops, other informal supports. So I like my early years started with research on, those types of social supports, including the church, and how does the church typify depression, and how does the church look at mental health, and how does it deal with it? And so, long story short, that evolved into a research a research project where I ended up finding out that there was, so much trauma that was going on in these communities. And I guess I just got, tired of, just the fact that lots of research has been saying over and over that there's trauma in the community. I mean, we could see, I know a friend of mine that would make a joke that Ray Charles could see that there's trauma in the community, right? So, I know that there's a lot of trauma in the community, but what's being done about it? And so, when I when I first found out about acceptance commitment therapy, I fell in love with it, and I decided to take a look at it in more detail and see if there was a way that this could be even more relevant for like African American communities. So I know that was a long discussion, but
No,
that's kind of how it started.
that's really helpful. I think it explains so much about the context of your experience of like where this real integration into Black and African American culture with regards to ACT came from, because you have this background that really kind of led just sort of so naturally to you getting to this piece. So what you end up developing, what you have developed is a culturally tailored treatment of acceptance and commitment therapy that is specific for Black and African American individuals. What I really love about it, and what I was so drawn to when I came across it, was, we're all taught in the field. I'm a therapist as well. We're all taught, be culturally sensitive, be a multicultural therapist, and it's sort of this vague idea of this stance that we're supposed to take. And I don't know if anyone really knows what that means. I don't
Right.
know. I don't know if that gives us the sort of detail and specific changes of what we need to do to really attune what we're doing, what treatment is done for the individual sitting in front of us, and making space for the entire context of their lives, including their cultural lives and sort of the system that they grew up in. So you did this differently. You took it to the research lab and you developed a model that is called Poof.
Right.
Please tell us what Poof is.
Okay. I'll tell you, but first I will say that I have not yet took it to the research lab per se,
Okay.
because and I can talk a little bit more about evidence-based practices and how they're developed. So Poof stands for pulling out a fire, and that name actually came many, many years ago, way before I even knew what Poof was going to look like. Pulling out a fire is actually uh, scripture. It comes from a scripture, and Poof, or pulling out a fire as a intervention, is not a religious intervention per se. However, um, those words come from Jude, and Jude only has one chapter, and it's verses 22 and 23. And they say, and if some have compassion, making a difference, and others save with fear, pulling them out of the fire, hating even the garment spotted by the flesh. And the reason why, Poof, that pulling out of the fire, was, kind of just stood out for me was, you know, that's what it feels like, for people who are fighting against a system that's not necessarily for them. Is that it feels like being in this fiery situation that maybe some people might, you might be able to just have a little bit of compassion for them, and are able to get out on their own, but others you will need to pull out.
Mm-hmm. Mm-hmm. And when you fell in love with ACT, it seems that you really saw that as a good fit for kind of integrating this model. Can you talk a little bit about why you chose ACT?
Right. Yeah. So I was a I was an associate professor at Azusa Pacific University for about 7 years, and that's a private college in Southern California. And while I was there, I taught a couple of classes, and one of the classes that I taught was an intervention and evaluation class for master level social work students. And so I was able to have the opportunity to actually kinda design this class, or restructure the class, and there were different modules, or discussions that we had each session, and one of the discussions had to do with, mindfulness interventions. Um, and so I remember, a few years ago when I decided, okay, I'm going to have a guest speaker for this mindfulness intervention, because at that time I wasn't as savvy about them. And I had my good friend and colleague, Dr. Regina Trammell, who's still at the university, come in and do guest speaking. So for that particular module, we would talk about the third wave interventions, such as dialectical behavioral therapy, mindfulness-based cognitive therapy, and then she mentioned ACT, and that was actually the first time that I had ever heard about ACT when she mentioned it in the classroom. So I went to a ACT training, and actually the first ACT training that I ever went to was a PESI training, and so I went to a 2 or 3-day, PESI training on ACT, and I have to say I was one of the few, Black people in the room. I mean, in terms of people of color, and maybe, it was a scattering of 1 or 2.
Mm-hmm.
Um, but I absolutely loved what I learned. Now, I can't say that I understood everything that was said those couple
Mm-hmm.
of days, because there's a lot of I guess psychobabble, in regards to some of the verbiage, but I really I really just like it connected with me. And I think one of the reasons why ACT connected with me, it was because, this is one of those interventions where you don't need a diagnosis in order to use ACT. In fact, I use ACT in my own life, as a day, on a daily basis, to move forward towards things that I value. Um, and, so I think, like, with African Americans, there's been so much stigmatization in terms of diagnosis,
Mm-hmm.
that just not having to have a diagnosis, that was wonderful. And, secondly, one of the things that I love about ACT is that it really normalizes pain.
Mm-hmm.
And so, like, everyone goes through pain. Everyone goes through, suffering at times. There's not anybody in this earth that would probably get away with not having any painful moments in their
Mm-hmm.
life. um so I love the way that the whole goal of ACT is just to take a look at what are our values, what are the things that really matter to us, and can we move towards those things even in the midst of pain,
Mhm.
even when things are not the way that we want them to be. And I think that that is like so much of a better goal than a decrease of or a reduction of symptoms,
Mhm.
um, to decrease anxiety or to decrease depression. I mean, that's fine, but but just, can you move forward on what really matters to you, even in the midst of pain? Then that really spoke to me. And then so I started taking more ACT trainings, and I still was probably one of the 2 or 3, people of color in the room,
Mhm.
and I began to kinda be a little irritated that I'm wondering why I didn't know about this intervention, and I'm wondering if other, clinicians of color know about this intervention, you know? So
Mhm.
so that's kinda how I went to choose ACT.
Okay. And you mentioned that as you're in this training and you're learning about it, that um, at least in those beginning phases, and this is absolutely true. There's psychobabble. There are terms that ACT made up that didn't exist before, and and it seems like there's something really specific that you did with your model, to address that. And I'm curious to hear you talk about that, and then also how you think maybe that made ACT more accessible to the African American community.
Sure. So, um, so I try to like put different hats on at different times, and I have like my researcher hat, I have my clinician's hat, and so when I think about the researcher's hat, I did like try to take a look at ways that other interventions are culturally adapted or they're culturally tailored, and like what are some of the various ways that are written in the literature about cultural tailoring of interventions. And so there is there is one particular method of culturally tailoring that I decided to kind of move forward on, and in that particular one, um, that we look at surface structure changes and then deep structure changes.
Mhm.
And so surface structure changes would be things like the just like what you were talking about, the verbiage itself. Um, it might be the method of delivery of the intervention. It might be just, some of the materials and the way the materials are delivered or administered. If it was, necessary to even translate the materials, that type of thing.
Mhm.
So those are more surface structure. Deep structure changes have to do with what type of like theoretical framework can actually be applied to this model. So in terms of deep structure changes, I incorporated the social determinants of health model to ACT, and
Mhm.
then in addition, I used cultural humility frameworks to help to shape the to shape Poof.
Mhm.
Um, but in terms of the surface structure changes, so I did, some changes in terms of the language that's used. So, for instance, ACT, they talk about psychological flexibility, and that's the goal. And, psychological flexibility is, I mean, it's not necessarily psychobabble to say psychological flexibility. I mean, that could be explained, but there's pieces of what's called the hexaflex
Mhm.
that deal with the psychological flexibility that are a little bit harder to understand. So, such as diffusion, self as context. What does that mean?
Mhm.
So there's, a number of words that are used in the hexaflex, which the hexaflex just simply means 6 sides. So it's a six-sided model to act that is used in order to increase psychological flexibility, in order to increase the ability to be able to move forward in the midst of pain.
Mhm.
Um, so so I changed some of the verbiage of those particular uh, pieces of the hexaflex. So instead of, like, for instance, self as context, I would possibly talk about something like, uh, I am more than my experiences.
Mhm.
Or instead of diffusion, then I would call it freedom to let go. Or instead of acceptance, I would call it is what it is. Or
Mhm.
instead of present moment awareness, that's another piece of the hexaflex, I would call it in the here and now. So I changed it to words that, I mean, not only are just simplified, but they also have some meaning in the African American community. So, like,
Mhm.
for instance, values. Values has been changed to like a discussion of living life like it's golden, and living
Mhm.
life like it's golden is actually uh, it's a song by Jill Scott, and many, I mean, not at all black people know who Jill Scott is, but Jill Scott is she's a pretty famous R&B singer
Mhm.
who has a song called Golden, and in the lyrics, it talks about what it would be like to live life like it's golden.
Mhm.
And so with the Poof model, instead of just like starting to talk about values, we begin to ask about, well, what would it be like to live a golden life? What would it be like for you? How, picture a golden life for you, and sometimes we might even actually listen to her song together, and then move forward from there. So I think those are some of the structural changes that are surface structure that I did, and also there's been changes in terms of metaphors.
Mhm.
So ACT uses a lot of metaphors, and metaphors are very powerful. But what I'm finding, or I'm believing, is that a more relevant metaphor can be even more powerful. And
Mhm.
so, as an example, I always think about when I first heard, because they have a metaphor about quicksand, and how, the more that you fight in quicksand, the more you'll sink in quicksand. So that, I guess, they're like, that's a metaphor for your thoughts. Like, the more you fight against your thoughts, the more that you will, kind of sink. And but I personally, I'm a city girl. I come from LA. I never saw quicksand in person. I don't know, I mean, I've seen it on TV, but it just wasn't relevant to me, or
Mhm.
as relevant as, something else might be. So instead, in the book, what I've done is, I have added metaphors, under each part of the hexaflex that might be, more relevant for African Americans.
I'm curious, what did you replace quicksand with? Because you're right, that is very, very unique in focus.
Yeah, I replaced it with there's a exercise on the strong black man, or the strong black woman, or I guess they call it the
Mhm.
strong black person.
Mhm.
But so there's a experiential exercise in regards to that, and how, you know how, if a person engages in that exercise, they realize how much they're actually carrying in terms of load, and
Mhm.
that anybody who is carrying that load would feel um burdened, I mean, anybody. So I think, like, the reason why, that was like a pertinent metaphor is because the strong black woman and the strong black man is such a cultural idiom that
Mhm.
takes place. I remember even in my own life, my mother, and it was with loving intent, but my
Mhm.
mother, you know, would say, we're strong black women in this, family, and we have to keep a stiff upper lip, and we have to
Mhm.
keep it moving, and we have to keep pushing, even when things, structurally are not the way they should be. And um so I think that metaphor is a little bit more relevant. Not saying the quicksand is not
Sure.
good. Yeah.
Yeah. Yeah.
Yeah.
No, that makes sense. It's making it so much more relatable and within the context of their experience, where, like you said, with your memory of your mother, it's really resonating with you. And I feel like that's what allows us to really make the changes in how we're approaching life and act, because it's very different than sort of how we're taught.
Right.
um so this is probably a really big question. If I think that the work that you're doing is so important, and my hope is that others will continue to look at those, both, as you said, the surface and sort of those deeper structural changes within the treatment approaches that we have in our field. What suggestions do you have for folks that might be looking to tailor this to a specific community of folks?
Well, actually, it's interesting because so I'm a part of ACBS, that's the Association for Contextual Behavioral Science, and that's actually the organization where acceptance and commitment therapy kind of branched from, because Steve Hayes and colleagues are a part of that organization, and Steve Hayes and colleagues are the founders of acceptance and commitment therapy. And the reason why I bring up the Association for Contextual Behavioral Science is because, like I had mentioned to you before, I realized that there weren't as many people of color, that like clinicians of color, that knew about this model. And so when I joined, there weren't as there weren't as many clinicians of color as I would expect that were involved in various parts of ACBS. So I decided that I wanted to become somebody who was involved. So, I'm a part of the diversity, equity, and inclusion, so special interest group with ACBS, and along with that, we have a free um, meeting spot that we have once a month. It's called Culturally Wrapped, and the way you spell it is culturally, and then RAPPED. So it's culturally wrapped, and mainly what we've done for this past year is have anybody who wants to meet once a week. I mean, not once a week, that would be too much. Once a month, to just like have a wrap session and talk about, their like these interventions, and how might change them or tailor them for my populations. And so we've had like drop-ins of people all over the world. It's not just like in the United States. It was, and I think that people have found that that has been, very, helpful to just have a meeting space to just chat about some of these things, and how can we change these things, or how can, we look at these things different. Now, we've been focusing mainly on acceptance commitment therapy, but you're right. I think the conversation should go much farther than that. To all of the interventions that we're dealing with. But if I had one thing to say, that in this journey of creating Poof, I realized that number one, Poof needed to be a group intervention. Couldn't it couldn't be an individual intervention. And the reason behind it is because structural racism is not an individual um, situation.
Mhm.
So what ends up happening is like we have all of these clients that are coming to us that are being affected by both individual issues and structural issues. And so the individual issues, the individual issues are are being dealt with by these interventions that we use, right?
Mhm.
But the structural issues are never being addressed because
Mhm.
our individual our the way that our interventions are created, they're created based upon these Eurocentric,
Mhm.
Western philosophies, individualistic philosophies, um, and so there's no way that they really can address the systemic issues.
Yeah.
Um, when you have a group together, then the group can become their own village. They can become their own social support, and with groups, there can become power. So when we've had these groups of these poof groups, which there haven't been that many, but there have been a few. But when we've had these poof groups, then the people in the group become their own village, and
Mhm.
they begin to start being able to look at not just individual issues, but structural issues, and how can I change? What are my individual values? What are my collective values? And
Mhm.
how can I change both?
Jennifer, we're running out of time. Thank you so much for sharing your reflections and sharing some suggestions for those who are interested in continuing this work in their own community. Before we start wrapping up, there's interest in the culturally wrapped group. Can you let people know
Sure.
how to find that?
Sure. If you will Google the Association for Contextual Behavioral Science, um, then once you Google that, you can become a member there for very little. I'm not getting kickback from them, but um, and then those are free groups that happen within ACBS.
Okay, great. I was going to try to pull it up, but I'm not that fast. Okay. And then also, uh, reminder that Jennifer's book, Out of the Fire, is now available, officially releases on the 1st of December. As a thank you to all of you for attending today, Jennifer has been gracious in sharing a free excerpt from the book that you can get at the following link, psychotherapynetworker.org/out of the fire. So please follow that link to get a free excerpt from the book. And then also as a thank you, if you go to psychotherapynetworker.org/Shepherd Payne, that's SHEPARD there is an exclusive discount for the Psychotherapy magazine that you can get as well. Jennifer, again, thank you so much. It has been a true pleasure. Thank you for the contributions you're making to the field, and please come back and join us again sometime.
No, thank you. Thank you so much. I enjoyed myself.
Great. Thank you. Bye, everyone.